Hey, welcome back into Parent Squad. In this episode, we're talking all things back to school, and heading back to class is about more than just making sure your kids have the right supplies. It's also making sure that they're getting all the necessary health checks to start the year off right. We're talking everything from physicals to vaccines. We know there's a lot to keep track of, and we've got you covered. So here to help break it all down is Dr. Lucas Huffman, who's a family medicine doctor with Franciscan Health. And we know there's a lot to check off the list, so let's break it down, starting with school physicals. First of all, thank you. Welcome.
Absolutely. Thank you for having me. Glad to be here.
Yes. Okay. So when we're talking school physicals, what do parents need to know about those?
Yeah, school physicals are a time for not only for us to talk about the health, development, making sure everything's going right from the growth charts, but it's also a time for parents to bring their issues to us as physicians or providers. Are there issues about nutrition, diet, exercise, screen time, sleep habits, getting tricks and tips that we can help the parent make sure the student has a successful year moving forward?
Yeah, I have a little boy, 15 months old, and I end up going with a long list of things in the notes section in my phone. And I'm sorry, I'm that person extending the doctor's appointments. But I got to get all my questions, and a lot of times I find doctors have those tips and tricks because they've seen a lot.
Absolutely, yeah. Sometimes the parent questions actually prompt us to talk about things we may not talk about with other families. So your specific issues, you have to ask us those questions for us to have the answers for you.
Yeah.
The best we can, of course.
Okay, well, put it in the notes section in your phone because you're going to forget. All right, so what about sports physicals for athletes?
Sports physicals are a little bit different. We talk about previous injuries, musculoskeletal injuries. Are you having any chest pain, joint pain? Are you having chest pain when you exercise or move? Have you had a history of concussions? We want to cover all of those things to make sure that you're safe to resume physical activity within the athletic performance or sport that you're playing prior to us just throwing you out there.
Yeah, even just something as simple as listening to a child's heart, that can make a difference. So, an adult too. But for sports physicals, does it start at a specific age? Is it when your kid is actually on the actual team, or what about just gym class?
Yeah, typically not for gym class. Every school or district is different, but we do have forms that the schools typically do give to the kids that bring to us as physicians, and we fill them out. If families forget those forms, we can often print them in the office, but there is a certain age and it is school dependent on that.
Okay, all right, check with your school. They'll probably let you know if you don't have it on file. Now, are there any extra screenings or tests that you would recommend for student athletes?
Rarely, but sometimes we do find things that need extra workup, such as student athletes with chest pain or having chest pain during exercise. Do you have a significant family history of heart disease? Oftentimes we can get an EKG or send them to a specialist. One important thing for athletes with asthma is to have an up-to-date asthma action plan. That way the school knows what to do when you're having certain symptoms, making sure that there's an inhaler on the sidelines, make sure your coach, the trainer, and the school is aware that you may need extra things that other athletes may not need.
I love what you're saying here because you're encouraging parents to make sure that it is group care. Obviously, you're leaving your children, even if they are older and they're 13, 14-year-old, you're leaving them in the care of someone else. So for that, adult to know what else is going on with their child, so maybe they can step in and help or recognize the symptoms.
Absolutely,
Sometimes as a kid, you're just go, and you're not thinking, and then it's too late.
Absolutely, and the one thing about the asthma action plans that a lot of Indiana schools recommend, they do have the symptoms to look out for on there. So it's beneficial to the caregiver, the coach, or whoever is using the asthma action plan for the athlete. Because as you know, athletes want to play sports. Sometimes they don't always tell you the symptoms.
Yeah. How far do you know, to push your kids? We talk a lot about the heat, and we all want our kids to put the phones and the videos games down and push them outside and everything. But it can also be a fine line too. Is there any recommendation for parents in that sense?
So I always tell parents or children, you can do exercise, you can do all the activity until it starts to hurt. Maybe push a little bit more past that, but then you're going to need a break. Especially with the significant heat, you're going to need a break every 30, 40 minutes at this point to hydrate and make sure that you're not passing out and getting overheated.
Yeah, I asked that because, many of us sometimes come from the generation of, you'll get water when you're done, or you'll get, water, you'll get a break when you finish. And, the generation that pushed us, but it is kind of important to know the signs. Let's talk vaccines, okay? Vaccines, let's talk about what's required at certain grade levels. Go ahead.
Yep. So all schools can be a little different, and all patients are sometimes on different vaccine schedules. But generally, when we start pre-K, we typically give Tdap, MMR, polio, chickenpox, hepatitis B. Then once we enter kindergarten, typically we get boosters of those similar vaccines if you stay on that series. Once we start middle school, we oftentimes give another booster of Tdap. We start the meningitis vaccine series. And at that time, we have a discussion with the family on if we want to start the HPV vaccine as well. And then when we go into high school, we typically give another dose of meningitis, and then those kids that are aspiring to go to college oftentimes need additional vaccines for college administration.
Okay, so clearly this is a very tough topic with some parents because there's so much information out there and everyone's looking for the right source and the right fit for their family. Do you have any advice? Because a lot of parents feel a lot of different ways about vaccines.
Absolutely. I'm the motto we use shared decision making. So this is their child. I give them the evidence-based resources that we use. I oftentimes encourage them to read resources that I give them. They don't have to answer the question in the visit that time. They can come back next week for the vaccines. But they do prevent a lot of disease, and they are very good for your children. Not only for your child, but the whole entire school community as a whole.
Okay. I like what you're saying there. Evidence-based research, people, not just social media, okay? And then we know that classrooms can be the spreader of illness. So let's talk about staying healthy. What are your tips with that?
Yes, classrooms are a great place to learn, but they're also a breeding ground for germs.
Oh my goodness.
The first thing obviously is hand washing. Soap and water for 20 seconds before handling food, ideally. Another thing is we've all seen the young kid that coughs and sneezes and forgets to cover their mouth. So teaching your kid, demonstrating within the house to cough into your elbow or your shoulder and then wash your hands thereafter as well. One thing that we often forget to talk about is the importance of sleep with immunity as well. So most kids need around 9 hours of sleep or so, a little bit younger, maybe more, a little bit older, maybe less. But that can prevent a lot of disease in and of itself. Sending them with a refillable water bottle can help, making sure they stay hydrated, maybe making it a game. How much can they drink? How many water bottles can they drink before they get home? Some kids often enjoy that. And then the routine flu and COVID vaccines that are needed.
Okay, yes, I told you I have the 15-month-old, and so I'm already like, oh, as we consider daycares.
Oh, yeah.
And I know getting sick is kind of a part of the process, but I still don't want it to happen.
Yes.
Well, doing those things can help prevent that.
Absolutely. Yeah, oftentimes parents say that they're sick for the first 2 years of their child's life because of daycare. They just keep bringing germs back.
Oh, that the parents are sick. Yeah. Okay, so the advice he's given for kids is also advice that you need to be using in your workplace, at your home, for yourself as an adult. We also know that going back to school can create a lot of anxiety in kids. They have new schools, new teachers, new classmates. There's kind of the social, emotional aspect of the change and the level up that's happening here. How do you navigate that?
Yeah, anxiety can be normal. It's a normal thing that we all feel before a new job, before a new task at a job as adults. So it's the same thing for kids. Normalizing their anxiety, kind of talking them through it, letting them know that a lot of other kids in their class are probably going to feel this way can help. Also getting them into a routine maybe before school starts. So a week before school, try to go to bed earlier, wake up earlier as they would before school, so that way they're not having as much anxiety about that topic itself. If they're still pretty anxious, sometimes you can do a dry run, is what we call it. You wake up in the morning like you would for school, you get dressed, you pack your lunch, and then you take them to the school, if the school allows, to do a little tour of the school. Where are you going to enter the building? Where are you going to exit the building? Where's your locker room if applicable? Where's your classroom?
Yeah.
That way on the first day, the kid knows where to go, and some of those first day anxiety jitters can be lessened.
I like that because I also hear you saying maybe you can start the routine like a week or two earlier.
Absolutely.
So you ease into it and don't go from a 9 a.m. wake up to a 6 a.m. wake up, which, as we know, that would be hard for anybody.
Absolutely, yes.
Okay, so mentioning, you kind of touched on it already, routine. How can we help kids feel more secure and ready to learn? You kind of mentioned being able to, see if you could see the classroom and get them acclimated or meet the teacher beforehand. Mm-hmm. As a family medicine doctor, it sounds like this is also something we can talk to you about. I mean, I know when we're talking about mental, emotional health, that might be another specialist, but we can at least get the conversation started with you.
Yeah, absolutely. As a family physician, you can talk to us about pretty much everything. If we don't have the answers, we can likely send you to the right people or the right pathway that can help you find the right answers. But having the routine for these children can create structure, and structure creates safety for a lot of these children. So the transition from home to school and back can be, the child can just worry about having fun, learning, and making friends, rather than all the other minute detail that they've already been doing the week before school.
Yeah, I tell you, friends, there is no manual. There is no manual, but good thing we have experts that can help us, and we have a community that we're building here on the show to be able to help us and have some of these conversations. Dr. Huffman, thank you. Is there anything else you want to add?
I don't think so, no. I think that was excellent. Things aren't always going to go perfect, but doing the best you can is often the best we can ask for our children.
Oh, he has mental, emotional support for the adults, too. We need that, too. We appreciate your time and your insight.
Thank you so much. Absolutely.
Thank you. Listen, you can get more on Franciscan Health. Just head to WTHR.com, and you can also find more info about Dr. Huffman on there as well. Thank you.
Thank you.